My name is Bob Santos. I was a practicing pediatric dentist. It was a wonderful way to spend 40 years. I was diagnosed with beginning aortic stenosis about 10 years ago. As my symptoms developed, it creates rather incredible limitations, shortness of breath, fatigue. The summer of 2017, Dr. Patrick Coleman said we have to proceed and decide how to approach this.
One of my favorite patients is Bob Santos. He went to dental school with my dad. Many years ago, we picked up a heart murmur and recognized that he had the beginnings of aortic stenosis. And we mapped out a path which included surgical aortic valve replacement. Well, that was many years ago, but he's a smart guy, and he kept reading and realized there were other options besides surgical aortic valve replacement. Fortunately, we had just started our TAVR program, and he was one of our first patients. TAVR's really become the go-to procedure for aortic valve stenosis. Previously, the only option was surgical aortic valve replacement, which is still a very good procedure for the right patient. But this is a procedure that allows us to replace the valve without opening the chest, without changing the chest mechanics, and through two tiny incisions in the artery rather than a large incision in the chest.
They're able to go home the next day, and once they go home, they actually don't have any limitations. They can drive, they can go back to their daily routines without any limitations.
It is a minimally invasive procedure, short stay in the hospital, ability to return to your normal activities in a matter of days, and it is just absolutely remarkable technology. Through this entire procedure, the coordinator here at Memorial, Atusa, directed me, held my hand, took me from place to place. Again, very personal, exceptional treatment.
I remember Mr. Santos. He was one of the few patients at the very beginning. We started the program, and he came in with his wife, and he was a very articulate, intelligent man. You could see that he knew a lot about the procedure, and what was really neat about it is we spent a whole day together at the clinic and going through the whole process and doing different tests. And by the end of the day, he looked at me and said, I feel very confident about the kind of service and program that you have created, and I do want to have my surgery here.
When you're considering the cardiac care that you might receive or a family member might receive, one of the most important things is your relationship with the doctor and their level of expertise. Santa Rosa Memorial Hospital is the region's premier cardiovascular center, and therefore take care of the majority of heart attacks that come in either by ambulance, by helicopter, or they just come through the door 24/7, 365. We have a tremendous breadth of expertise in the community, whether it's from non-invasive or non-interventional cardiac services to interventional and invasive cardiac services.
When we started doing the TAVR workup to make sure we have everything that we need before we do the procedure, we found a mass on his liver. That was confirmed to be cancer, and that would have never been discovered had he not gone through this process and procedure. We decided with a team of physicians to fix the valve, which we did. Upon his valve being replaced, he was able to go to Stanford and take care of his liver cancer, and that essentially saved his life on 2 counts. I saw him 30 days after his TAVR procedure, and to see how active and happy he was, that he was back to having a quality life, was really, really rewarding.
I must say that the staff on either side of the procedure was as good as it could be. The cath lab staff, the nurses there are just absolutely incredible. They're friendly. They're doing a lot of things that are not easy to do as they prep you, and they somehow are able to put you at ease. My life has changed in several ways, but I can now do things once again, like walking my dog in the morning for 2 or 3 miles, whatever kind of thing. But I would say I'm back to normal, and it was almost instantaneous.
Bob was an excellent TAVR candidate. When somebody's an active person and limited by their valve disease, we can make a tremendous impact on both their quality of life as well as their quantity of life, their survival. You can touch individual patients' lives very closely. So this has been a really rewarding part of my life and a really rewarding career in cardiology for me.